Hi, my name is Gerald Brandt, and I'm a general surgeon. We're talking today about skin lesions. Either you have found a skin lesion that is bothersome to you, or your primary care physician may have found one that they're concerned about and would like some further information on it. When we talk about skin lesions, many times they're simple skin moles that are not concerning, but there's always a possibility that it could be a form of skin cancer. In order to find that out for sure, we do need to get a tissue diagnosis. And that involves either taking a small scraping of the skin lesion or excising the skin lesion completely. Typically, when I do a skin lesion biopsy, I usually recommend excising the whole skin lesion. When we talk about excising a skin lesion, we typically numb it up with a poke and a burn all the way around using local anesthetic so that you don't feel anything further. We then make an elliptical excision all the way around the skin lesion with an attempt to get normal tissue on either side of the skin lesion. Once that skin lesion is completely removed, we do use stitches to close that defect up. Typically stitches on the inside that dissolve on their own and glue on the outside. However, on occasion, we do need to use stitches on the outside that would have to be removed at a later date. We then send that piece of tissue off to the pathologist for further evaluation and review. In the meantime, I typically tell people that it takes about 2 weeks for their skin incision to heal up completely. Risks of the procedure are pain, which should be minimized since you are completely awake during the procedure. If you're having discomfort, you can let me know and we give you more numbing medicine. Bleeding or infection. If you do run into an infection, we do have to give you antibiotics occasionally, or sometimes we do have to open up that skin incision and drain out the infection on its own. Rarely, but on occasion, we do have to take you back to surgery for further excision if we need to get negative margins on any of the lesion that may have been inadvertently left behind. Once we get the pathology back in 1 to 2 weeks, we do typically notify you of the results and then talk about any further steps that would need to be taken at that time. If you have any questions or would like further information, please feel free to set up an appointment with me to discuss this further. Thank you.